A big part of my work as a pediatric surgeon is focused on trauma. And as a result, we unfortunately have to treat kids with bullet wounds. I often tell this story in Chicago. Was one of my first times as a young pediatric surgical trainee treating an infant with a bullet wound. And I still remember that case. It was unfortunately not the last. I tell that story because that little baby did survive but remains paralyzed to this day. And that case has really stuck with me. I continue to see kids with those bullet injuries week after week. So this is unfortunately a recurring issue that we're seeing on the front lines. So I would say that how can I not make this my mission, right? How can I not make tackling gun violence one of the most important elements of what I'm trying to do? Being on the show was an incredible experience for me, in particular because the patient that we treated on the show was a gun violence victim. And it was intricately weaved in with my work as a director of our Northwell Health Center for Gun Violence Prevention. Doing what we do is really a privilege. No matter the trauma, no matter the type of situation that we have to deal with when it comes to a baby or operating on a little baby, so many of these kids do very well. And we get to see that progression, right? We get pictures throughout their lifetime on how they're doing. We get to see them grow up. And that by far is the most rewarding part of this job, and one of the reasons that I just love being a pediatric surgeon.